Nandita, please.
A very good afternoon to my seniors, colleagues as well as students. I am here to give a very short introduction to stem cells in neuropathology, my area of interest. So the objectives of my lecture are going to be to enumerate what are the neural or glial stem cells in normal brain, what's the scope of stem cells in neuropathology, what's the difference between neural stem cells versus glioma stem cells or tumor stem cells, specific reference to stem cells in gliomagenesis, any diagnostic, prognostic or predictive markers associated with stem cells that can be targeted, and therapeutics in the pipeline. So there are niches or special areas in the brain which have the neural or glial stem cells. The function of the glial or neural stem cells is to maintain the general stem cell numbers, become progenitor cells which migrate to different areas in the brain and maintain cell populations there. And also they have a role in neuroprotection, which is very important after injuries. Now, where are these neural or glial stem cells in the normal brain? Neural stem cells can be found in several locations in the adult brain, including the subventricular zone, dentate gyrus, and the subcortical white matter. However, the most important area is the subventricular zone, and that is because the stem cells there have been reported to be associated with gliomagenesis. What's the scope of stem cells in neurological diseases? Neurological diseases can include degenerative diseases, multiple sclerosis, which is an autoimmune disease, and also injury-related diseases. But all of these diseases are not biopsied, and the only way we look for the stem cells are at the time of autopsy. Therefore, there is not much neuropathological role in those conditions. Whereas brain tumors are commonly biopsied, histologically classified, molecularly defined, and prognostic and predictive role of stem cells are known in brain tumors. What is the difference of a neural stem cell from a cancer or glioma stem cell? A cancer stem cell is just a normal stem cell that has oncogenic potential in the host. It can lead to a heterogeneous population of cells that comprise the tumor mass. Now, the glioma stem cells, like all other cancer stem cells, have the functional characteristics of being able to self-renew, cause proliferation, initiate tumors, and also are present in significant amounts in a tumor to express cell markers which can be identified, and they can differentiate into different cell populations within a tumor. In addition, glioma stem cells in the brain have the ability to basically cause invasion or spread of the tumor, have immune evasion, that is, they evade the immune surveillance of the body. They also give rise to interaction with tumor microenvironment, which includes development of new blood vessels and some growth factors. So what is the role of stem cells in gliomagenesis? Basically, stem cells in gliomagenesis, that is brain tumor genesis, is basically origin of brain tumor propagating cells from the glioma stem cell. Where are these stem cells present? They are present in the subventricular zone. The subventricular zone, just underneath the ependymal cells which underline the ventricles, are your neural stem cells. Whenever there is a mutation in these stem cells, they propagate and migrate away from this zone to different areas in the brain where they give rise to tumor formation. What are the common gliomas in the brain? The common gliomas in the brain are astrocytomas, oligodendroglioma, and the highest grade tumor, which is a glioblastoma multiforme. As you can see from the survival curve or progression-free survival, glioblastomas have a very low overall survival, only up to 12 to 15 months, despite advances in surgery, radiation therapy, and very expensive chemotherapy that includes temozolomide. Despite all of this treatment, these tumors are marred by therapeutic resistance and recurrence. So there is a need to research molecular biology of these tumors, including the role of stem cells in these tumors, so that it can be targeted and these tumors can be treated better. What are these glioma stem cells? They are a subpopulation which are identified within glioblastoma, a brain tumor. Compared to neural stem cells, glial stem cells exhibit enhanced self-renewal and compromised differentiation. They have a key role in resistance to conventional therapies as well as recurrent disease. In glioblastomas, these stem cells express unique surface markers which can help in identification of these cells as well as target these cells. They also modulate signaling pathways which promote tumorigenesis, and they cause vascular formation and changes in the tumor microenvironment. Therefore, these are very, very relevant targets for directing therapy against in glioblastoma multiformes. What are the important cell signaling pathways which are seen in glioma stem cells? The important cell signaling pathways are the Notch pathway, the sonic hedgehog pathway, and the Wnt pathway, which are essential for preserving multipotency of the stem cell and for creating the self-renewal or maintaining the stem cell of the glioma stem cell. Glioma stem cells upregulate a lot of these pathways, and it may differ in different tumors, and they are required for maintaining these stem cell populations within tumors. So how do we target these tumors? How do we target these stem cells in glioblastomas? We can target them by targeting their cell surface markers, by targeting the signaling pathways, or by targeting the interaction of these stem cells with tumor microenvironment so that they are not able to sustain. So the real challenge in glioblastomas are that these tumors are radio-resistant and chemo-resistant, and they are always marred by recurrences. And it is hypothesized that this is because of increased population of glioma stem cells within these tumors. There are different mechanisms by which these cells remain in the tumor, and all of these mechanisms are opportunities for therapeutic intervention on glioma stem cells in these tumors. So we have to target the stem in order to treat gliomas. What are the therapeutic strategies to target these stem cells within glioblastomas? As you can see from this figure, there are three important things that we target. One is the cell surface markers on these stem cells, signaling pathways which help in proliferation of these cells, and the microenvironment and the interaction of these stem cells with microenvironment that helps it stay. What happens as a result of targeting of these markers? As a result of targeting of these markers, there is induction of apoptosis in the tumor cell, differentiation, autophagy, and also these markers can serve as a starting point for making vaccines against these tumors and also epigenetic drugs. So the therapeutic targets, if I repeat again, would be to target the cell surface markers, signaling pathways, interaction of these cells with tumor microenvironment. What's the role of neuropathology in all this? What we do is we have different tests like immunohistochemistry, flow cytometry, or PCR, by which we can identify as well as quantitate these targets within a stem cell population in a tumor. What are the targeted therapies? The first is therapeutic targeting by surface markers. The important surface markers of glioma stem cells are CD133, EGFR variant 3, and L1-CAM. These markers are amongst a big list of markers, but the importance of these markers are that there are specific drugs which are available which can target these markers and therefore give rise to better response to treatment. What are the signaling pathways which can be targeted? We have the Notch, sonic hedgehog, Wnt, VEGF, STAT3, and BMP. Again, we have targeted therapies which can block these signaling pathways. How do we target the interaction of the stem cell with the tumor microenvironment? There are a lot of things in the tumor microenvironment like other tumor cells, neurons, macrophages, T cells, and vasculature. And all of these need to be targeted in order to dry out the glioma stem cells. So microenvironment is essential for maintaining the glioma stem cell stemness. And this microenvironment, the most important components are microvasculature and macrophages. What are the important markers for the microenvironment in a tumor? The important markers are markers as in the things that we identify in our biopsies or that can be measured in blood. So the important markers are VEGF and periostin. There are drugs which can target these markers depending on their levels expressed. Therefore, we can target the interaction between the glioma stem cell and the microenvironment, and that can represent an alternate approach in glioblastoma therapy. So to summarize the therapeutic strategies, there are various avenues for targeting glioma stem cells in glioblastomas, which can selectively poison epigenetic, metabolic, microenvironmental, post-transcriptional, and immune interactions of these tumors. There are already a whole list of diagnostic markers via immunohistochemistry that we do on our tumors. But all of these markers are only diagnostic. They are not very reliable as to the predictive value, that is, response to treatment. Similarly, there are several markers which are associated with glioma stem cells, but not all are important. The very important markers are Nestin and CD133. And these are markers which are very easily identified on immunohistochemistry performed on these brain tumors. So the markers of glioma stem cells are several, and not all of them are important or viable in the clinic, but Nestin and CD133 are reliable and present in the market. So to conclude, glioblastomas are tumors in which there has been very little progress made towards improving patient outcomes and survival despite all the advances in therapy. Understanding the molecular biology involving stem cells in these tumors is needed so that therapy can be tailored towards addressing the root causes. Stem cells in gliomas can be identified and quantified using IHC, flow cytometry, and PCR performed on biopsy material, and directly targeting glioma stem cells and their microenvironment is a promising opportunity to eliminate the likely source of gliomas and the nidus of their recurrence, which is the main problem, mortality and morbidity. Thank you so much.
Thank you, Dr. Vandita, for very lucid discourse on the role of stem cells in neuropathological disorders. Now, this topic is open for discussion. 1 or 2 questions. Any questions?
Dr. Vandita, just one query from my side. Any clinical trials have they, because we all know that this is a very lethal tumor, and you rightly mentioned that it's chemo-resistant and radio-resistant. So what has been the progress? Of course, we know that a lot of research is going on, but any clinical applications as yet, any trials going on anywhere, any part of the world?
Yes, in the US actually there are 2 trials on vaccines which have been developed against these glioma stem cells in phase 2 and phase 3. So maybe in the next 3 years there will be a vaccine against glioblastomas, which are the worst kinds. There are also a lot of trials based on combination drug treatments which are less cytotoxic because they only target the stem cells and leave the normal brain unaffected. So it's very much there, it's not exotic, and I think in our patients especially the overall survival is even less. It's only 3 to 4 months, and there is huge potential for this in treatment in medical practice.
Thank you. Thank you.
Thank you very
much.
Now I invite Dr.
I have a question. When we are talking in glioblastoma, since we know that is one of the dithering and very challenging tumor in the management, using even the cell-based technologies or immunotherapies, various kind of, are you aware of any drug-targeted treatments using MSC for glioblastoma?
Yes, sir. Like I said, they are in trial because the cell signaling pathways which are involved in glioma stem cells are similar to those in neural stem cells. So these pathways are already known. It's only that a couple of mixed drug therapies are needed to target them based on the expression in a particular tumor.
So here one of the studies says that we could tag the therapeutic chemomolecule to MSCs, and MSCs are having chemotactic action towards the tumor or any healing process wherever inflammation. And tumors are a kind of inflammation always, a kind of inflammation. So almost all targeted chemotherapeutic molecule can be chemotactically targeted to the tumor using MSC tagged with chemotherapeutic molecule, which is a target molecule. This is one of the research which is in pipeline, probably will come as a very good solution in future.
In the COVID era, sir, all of us know about mRNA vaccines. There are a lot of mRNA viral vectors which are already being used in glioblastomas injected locally within the tumor. Like I said, they are in phase 3 and phase 4 trials, in fact, in the US. So it should come in the market in 2 years.
Just one question. As you mentioned, the vaccine can be effective in these patients.
Yes.
And what is the mode of action or how the vaccines will be delivered through virus or some other ways?
They are given locally, intraoperatively.
Now, is it called vaccine or is it sort of modified chemotherapy?
It's called a vaccine because there are susceptible populations who are more susceptible to these tumors or have low-grade tumors which are molecularly like glioblastomas. So as a preventive or preemptive measure, those vaccines are given in the tumors at the first surgery, before recurrence. So it's vaccine to prevent a recurrence or a higher grade tumor. They can't be given to normal people.
That's
Yeah,
the
they can't
point.
be
You
given
know,
to
the
normal
vaccine conventionally is different
The
ideas.
vaccine is for those who are operated at the first.
To miss after the surgery, you inject locally to prevent the recurrence. Is it?
At the surgery site, it is injected.
Obviously, after the excision of the muscle,
Yeah.
and maybe you do the cryo or immediate histopathology and give the vaccine.
Yeah.
Is it like?
That's
Thank you, Dr. Vandita. Thank you very much.
Now I invite Dr. Pradeep Mahajan from Mumbai to talk on.
Sir, I would like to request our director, sir, to kindly present a memento to Dr. Vandita Madam.
Dr. Pradeep Mahajan from Mumbai to speak on role of regenerative science in cerebral palsy. Dr. Mahajan, please.